So, why are we here? 40 million women have fibroid disease. 80% at least of black women and 70% of white women by age of 50 will develop this disease. And by age of 30, 35, 60% of black women and 40% of white women. It's very common. 26 million American women suffer significantly from this disease, physically, mentally, socially, economically, because they suffer, they cannot even go to work or study. And 1.2 million women agree on big surgeries, like 600,000 approximately myomectomy, 600,000 hysterectomy, removal of uterus for benign disease. They so suffer that they're ready to get rid of part of the body. And because it's so scary to have such a terrible treatment and surgery, vast majority, 90+%, just suffer in silence, kind of just go through life without normal, best version of the life. Prolonged heavy menstrual period, pain during intercourse, bleeding, small bladder, constipation, miscarriages. Do you understand that this disease kills your life, ruins your life, and kills the babies? Miscarriages, #1 reason for miscarriages, fibroid disease, of course, because fibroid tumors, they grow as big as a grapefruit or larger, and they compete for the baby for blood flow, blood supply, and space. It's also killer of the life, because if you don't have normal, if you suffer so much, you cannot go out, you cannot have a normal family, you basically waste the best years of your life. And why is that so terrible that 90+% of the women ready to suffer and waste their life? Are they so not smart? Do they like to suffer? They just don't know. That's why we're here. They do not know. Now, some of it is fault of the doctors too. When they go to doctors, and many doctors don't even offer ultrasound, not aware that, doctors are busy. If you breathe, you walk, if you're not dying, it's a good thing. And doctors sometimes don't understand. It's not good enough. So, ultrasound's not offered. Am I right? People just don't know, don't diagnose. If they diagnose, many doctors, not a big deal. Yeah, in that mind, if I can just explain what goes in the doctor's mind, sometimes it's, you're not dying, you're fine. My surgery is terrible, it's a big surgery. I really want you to suffer a lot, but it will be better than my surgery. But what they don't tell, that there's not surgery. There's a minimum invasive uterine fibroid embolization procedure, no surgery. And it's definitely this treatment through the needle hole with a tiny catheter, 30, 40 minutes. I've seen Dr. White, 12 minutes. I record this from beginning to the end.
Wow. Wow.
Hour later, go home. 2 days later, go to home. And that's the alternative that nobody knows. So it's really secret. It's really secret because nobody knows. So what I encourage, we'll obviously share all this information. I encourage you tomorrow, today, day after tomorrow, be comfortable starting this conversation, probing the question, do you know about fibroids? Do you know this fact, that fact? Do you know that you don't have to suffer? Do you know majority of people suffer? Just promise to share with 10 people, and before you share the secret, you make sure that they pledge to tell 10 people each. And 3 times like this is 1,000. 3 more times it's 1,000,000. What do you think will happen after this? Nobody will suffer. Nobody will suffer, and that's why we're here. Fibroid Fighters, USA Fibroid Centers, to make sure every woman have the best version of her life without any limitation. So, thank you very much for coming, and being part of it.